Saw my doctor in September of 2018, just a family doctor. I had a hernia. So I went for the hernia surgery. I'm in there, I'm getting prepped. They put me on a heart monitor and they ran it and said, you have AFib, which I really had no idea really what AFib was at the time.
When he first presented, he came with atrial fibrillation. His case was very interesting because he was a healthy individual without any risk factors really.
So that was the eye opener that, yeah, this is not good.
The most common arrhythmia that we encounter is atrial fibrillation. You know, atrial fibrillation is a heart rhythm disorder that affects primarily the top chambers of the heart. You know, it is a chronic disease that is chronic progressive, and if unchecked, it can be more difficult to treat later. You know, Leroy was a younger patient, and you know, we talked about his options. You know, we talked about medications. You know, the downside being that if he were to start a medication for rhythm control, it would need to be something that he would take indefinitely.
I didn't really want a solution of medication, so I'd rather have it fixed and corrected, and the ablation was a way of a long-term fix.
And generally what I tell my patients is that when you have an ablation, if you choose to do that, once the ablation's done, whatever benefit you get from the ablation you keep, versus from a medication, it only works as long as you're taking it. You know, I've been an operator that's been using the HeartLight system since 2016, and I believe I was the third commercial user in the United States. So there's several unique features with the HeartLight versus other ablation systems. Is the endoscope, which actually lets you visualize the tissue, while you ablate, and so you're able to give clear overlapping lesions, that hopefully will result in durable results and be less likely to recur later. With the latest generation of the device, which is the HeartLight System 3, which has something called rapid mode, it's really made an enormous difference in terms of workflow and reduction of the procedure and reduction in need for x-ray during the procedure. And it's been a game changer. The visualization, which really reduces your need for fluoroscopy, which is video x-ray, and reduces radiation exposure. For the patients that are symptomatic, I feel like they have definitely benefited from the HeartLight ablation. A good number of patients have been able to come off medications, that we're taking specifically for prevention of atrial fibrillation, which, is a big deal for, a number of them in terms of, quality of life and, ability to do what they want to do.
After I had the ablation, I really noticed that I felt better. A couple days after that, middle of that week, by the end of that next weekend, I really felt more energy. It just felt better. I just wasn't as tired, as fatigued. So that was the only real symptom change that I noticed, because you kind of gradually go into something and you really don't know it, but once you have like a 180 on it, you really feel, oh, I just feel better.
Yeah, he's been doing amazing. It's been over a year and he's not had a single symptomatic episode of atrial fibrillation. And as we had mentioned, it wasn't quite clear to him initially when I saw him how symptomatic he was from his AFib, but he reported that he was doing much better in terms of his exercise tolerance and really his symptomatology overall. Obviously, he's someone that has a very long life to live, and we just want to preserve that quality of life. The 10,000th patient milestone is a fantastic accomplishment, really for any medical device, and is a testament to the quality in terms of effectiveness of the treatment and safety of it, and also generalizability to operators in the real world.